Hi, my name is Shirley Pinnaker Johnston. I'm the director of the Medical Dosimetry Program at Thomas Jefferson University in Philadelphia.
And I am Matt Marquez, director of the Radiation Therapy Program at Thomas Jefferson University.
Dosimetrists are part of the physics team who design and calculate the radiation treatments for the cancer patients. When the new therapy and dosimetry students start their programs, there's so much information for them to learn in 1 year. Bootcamp is used as an introduction into the field of radiation oncology. We tried to design our version of Bootcamp by following what steps an oncology patient would encounter. We start with some of the vocabulary, since it's challenging to engage in a conversation without an understanding of what those medical words mean. Then we apply some concepts: professionalism, legal and ethical issues, interprofessionalism, and patient empathy. The therapy and dosimetry students attend Bootcamp together. This is done as an example of how the focus is on the patient's care through multiple coordinated efforts. Once we teach the students some basic skills, they have the opportunities to practice on each other. This not only strengthens their skills, but gives them a better appreciation for the patient's perspective. It also gives them a better idea of how to explain some of these procedures to the patient. So what Matt and I want, for not only for the students to practice, we want, because everybody will have a turn being the patient. How would you describe that process to a patient like me and Christine, and say what for the whole experience? Because now you've been...
I'd say the mask feels almost nice when it first goes on. It's relaxing and nice and warm, but when it starts to tighten up, you do feel kind of a little sense of panic.
What our hope is, mine and Matt's, in having the students do this during boot camp is once you go out to the clinical, you not only have the good skill of the mechanics of how to make it, but now each of you will have the perspective of the patient. So you'll understand if your patient starts to have that panic attack.
Radiation therapists are responsible for delivering prescribed doses of high-dose radiation to cancer patients. To review anatomy, students are assigned body sections and give PowerPoint presentations during the first week of boot camp. Having the students teach each other has several advantages. It helps develop their communication skills as well as reinforce anatomy knowledge. This also gives us a segue for introducing cross-sectional anatomy. As we move into more of the technical part of radiation oncology, multiple resources are utilized. There are several labs which include VERT, which is a radiation treatment machine and simulator, standardized patients, lectures and videos, and treatment planning computers. At the end of boot camp, we give an exam to assess acquired knowledge. This exam is reviewed with the students. It shows both the faculty and the student which areas need to be strengthened. After boot camp, the students go out to the clinical sites. After a few weeks, the students and the clinical instructors are sent a form to evaluate the level of knowledge and benefits which came from the students' time at boot camp. Although there is always room for improvement, the feedback has been overwhelmingly positive from both the students and the clinical supervisors.
I think the best part about boot camp was this introduction to the terminology and the conceptual elements so that we could enter clinical on day one running. Even as a passive observer, we can sit back and understand what the therapists were talking about. I think just, even from shadowing, even just knowing the full scope of the therapist's duties, I think maybe going into it, maybe I thought it was more about pushing buttons and setting the patient up, and it wasn't as precise as it was. And even something as simple as walking the patient to the room and asking them how they're doing isn't just asking them how they're doing. You're looking to see if they're walking okay. You're looking to see if their mental functions are still okay, and if they have to see a nurse or a doctor before they start treatment. Yeah, just the ability to think critically, probably deeper than I would have initially.
So boot camp was really a great experience, especially for me because I had an undergrad in biology, so I had a little bit of the health, but in terms of the treatment planning and the patient immobilization and even the vert room, actually seeing the gantry and the linac was really important because I hadn't had any of that. So all of the initial terminology that we learned and all of the just the introduction to what all this radiation oncology is was really important, and I think it was really great. When we got there, the dosimetrists were talking about isocenter, and they were talking about triangulation and SIM, and I had no idea what any of this was before we had boot camp, so that was definitely important. Even patient setup and initial treatment planning, that would have been a super big problem for me, just because you don't think about looking at a CT, everything is opposite, left is right and right is left, so that would have been a problem if we hadn't had that before we got there. Splitting the groups up was definitely a plus, so the therapists went and did their therapy, and then the dosimetrists went and worked on a little bit of treatment planning. I think a little bit more on the treatment planning aspect would have been a help. You never really think about the personality and the patient interaction that you have to have in terms of dealing with the patient behind closed doors. So dosimetry, we sit, we have the scan, we plan the patient, but you never think about, oh, I actually have to talk to this patient has feelings, this patient is a real person. So having the therapy group with us as well did help. It kept you aware that these are real patients that you're dealing with at the end of the day.
I feel like boot camp provided me with the necessary background information needed to succeed in a fast-paced radiation therapy department. I remember during my first week of clinical, I was recalling definitions that I learned in boot camp that I'd never even heard before, and I liked being able to keep up with what the senior therapists around me were talking about and actually understand what they were saying. And it felt really good to feel helpful in my first week of clinical as opposed to just sitting back and observing. I did know that there was a dosimetrist, but what I learned in boot camp was how close the dosimetrist and the radiation therapist actually have to work together. Like something might look so good on the computer, but without the therapist, the dosimetrist might not know it's actually applicable, like staying still for that long or the couch kick and the gantry angles.
Okay, well, I definitely thought it prepared me. Some students have X-ray as a background, nuke med as a background, MRI. I didn't have any of that. I just felt really prepared. I didn't feel like I was just thrown to the wolves, essentially. Definitely the medical terminology. I remember learning about SSD and SAD, and I had no idea what that was. So if we hadn't had that in boot camp, then I don't know, it just felt like it would have taken me longer to understand some of those concepts. And it was nice to have boot camp because I felt like I could ask questions. Whereas when you're in clinical, it's hard to just stop and ask questions right when you have a patient on the table. So I felt like boot camp kind of went at a slower pace for me. So, it really did help me